You're listening to the Co-Creator Network. When you change the way you look at things, the things you look at change.
Hey everybody, this is Maxine Taylor with another edition of Move Into the Magic. And I am so thrilled to have as my guest one of my health practitioners. The reason I have invited her to be my guest is because she is responsible, single-handedly, for allowing me to regain my health. And I think many people listening to the sound of my voice now could benefit by just listening to the information she's going to share with us today. If you think this is an endorsement of Angel Nofziger, yes, it is, because I feel like I'm 30 years old again. Let me tell you about Angel. Angel is a women's health and adult health nurse practitioner here in Atlanta. She grew up in Ohio and did her undergraduate training at Ohio State University. Then she moved to Atlanta and completed her graduate training at Georgia State University. Angel always had a desire to work in a natural medicine setting and learn more about alternative medicine. And she was able to do this the minute she finished her graduate training, which is, a sign as far as I'm concerned. She trained under functional medical doctors and through American Academy of Anti-Aging and Regenerative Medicine, as well as other functional medicine organizations. After a few years of in-depth transitional, a major paradigm switch for her to holistic medicine, Angel knew she had found her calling, and she hasn't looked back. She has been with Preventive Medicine in Atlanta, Georgia for the past 3 years. The director of this wonderful organization is Dr. Robert Burkich. Angel likes to sum up functional medicine as the type of medical care that uncovers what is not functioning correctly in the body and then fixes it as naturally as possible versus covering up symptoms with medications. I know you're going to love to hear what she has to say. So, Angel, welcome to Move Into the Magic.
Thank you so much. Happy to be here.
Now, first of all, tell us about functional medicine and how it differs from conventional medicine.
Mm-hmm. Functional medicine is quite different from conventional medicine, and how we operate is we want to take whatever problem you're having and try to figure out what the root cause of that problem is. For example, if you came in and you were having some kind of digestive complaint, we wouldn't want to just label it as a diagnosis and give you a medicine and hope that resolved. We would really want to dig into your digestive system, figure out what was going wrong, recorrect that, and hopefully you'll actually be healed of whatever your complaint was. So another way I kind of describe it is systems medicine, because one system misfunctioning will always affect another system in your body as well. So for example, somebody might have a myriad of unrelated symptoms like headache, sinus congestion or allergies, and stomach problems. And rather than looking at each of those symptoms as completely different, we will look at all the systems as a whole and see how they possibly might all tie in together and be one system that's really misfunctioning and is affecting the other systems in the line.
Oh, truly holistic.
Yes.
Truly holistic. Okay, well, Preventive Medicine is the company that you work for. Mm-hmm. Will you tell us some of the services you offer, some of the functional medical services that you offer? Now, I've experienced some of them, so I'm going to let you do the talking.
Yeah. We do a lot of bioidentical hormone replacement. We can get into that a little more later, but hormones not only just being your estrogen and testosterone and progesterone, but also your thyroid hormones and your T4 and T3 hormones, as well as adrenal hormones like cortisol and DHEA. So we really look to balance hormones. It's a huge part of body functioning. We treat a lot of just general illness as well from that functional standpoint. People come in all the time just for a bronchitis or a cold or a physical, and again, we're still going to look to really uncover what's going on and what's causing that. We do treat a lot of autoimmune disease, so things like Hashimoto's thyroiditis, rheumatoid arthritis, lupus, things like that. Again, trying to figure out what is really causing the misfiring of this immune system so that we can hopefully eventually heal it and not just cover up the immune functioning. We do work with cancer patients, even those receiving conventional medicine, to help reset their immune systems, especially after they've done chemotherapy or radiation, to kind of get their energy back and detox them. We treat a lot of leaky gut, which we'll get into a little more as well, and GI disorders, things like Crohn's disease and IBS, and all kinds of bacterial and yeast problems in the gut. We do a lot with heart disease patients and vascular disease. So treating people a little differently. It's not all about cholesterol and medication, even though, yes, high cholesterol is many times a consequence that leads to heart disease, but the true underlying cause is what we're always after, and that many times is inflammation. So as we really focus on inflammation, free radical damage, and diet, we have great success in reversing heart disease and getting people's heart functioning much, much better. We even do some IV therapies for heart disease that can help to soften plaque and remove it from the body naturally. We have a couple IVs that we do. Another one is called Chelation. And chelation IVs are to remove metals from the body, things like mercury and lead. And we do a lot of specialty testing as well. We do a lot of adrenal function testing, food allergy testing, micronutrients, neurotransmitters, stool testing. So a lot of different options that you wouldn't normally get at the doctor's office. And then, of course, we use a lot of supplements in our treatment protocol, and a lot of diet and natural interventions as well.
Wow. Well, one of the things that my friends and clients have told me is that they're definitely interested in natural healing, as close to natural as possible. What they have told me is that, unfortunately, they have not been able to afford it. Mm-hmm. And I am thrilled because what I discovered at Preventive Medicine is that with insurance, health insurance covers so much of it, mm-hmm. which makes health affordable.
Right. Mm-hmm.
It makes it easy to be healthy. So, and I have been to different doctors who did bioidentical hormone replacement, for example, and did not accept insurance.
Right.
So it became an incredibly expensive proposition, mm-hmm. incredibly. And preventive medicine here in Atlanta, in Sandy Springs, has eliminated that problem, yeah. as far as I'm concerned, mm-hmm.
which
thrills me to pieces. So that's just my personal testimony. You'll be hearing more of that from me as we go through this, because I'm so grateful for all of the health improvements that I have experienced at Preventive Medicine. And I'm sure there are medical facilities around the country similar to yours, Angel, but you are the one I know.
Right. Yeah.
Now, let's talk about leaky gut. Mm-hmm. You've got to explain this to people, because so many people I've discovered have the symptoms and don't even know they have the leaky gut. Will you talk about that?
Yes. Leaky gut is kind of the informal term we use for a permeable gut. And that is not a diagnosis you're going to hear often at the doctor's office or on TV or anything like that, but it is something I'm seeing every single day in my practice, and it does need to be addressed. And what's going on with a leaky gut is that there is some kind of chronic underlying inflammatory response in the GI tract. And by gut, we mean your stomach and your intestinal lining. That makes up what we call the gut. And this chronic inflammation over time creates damage in the protective lining that is protecting your intestines and your stomach from the rest of your blood in your body. And as this lining gets damaged, little tiny micropores begin to develop in the gut. And they are so small that you would not see them on any type of a scan or on a colonoscopy, but yet they're big enough where contents in the gut can leak out into the bloodstream. So we're talking food particles, gluten molecules, yeast spores, bacteria, and as these things get out into the blood, they get into systemic circulation and into your organs, and they cause a myriad of symptoms in the body, because essentially your body's becoming toxic. There's toxicity in the blood, the immune system's aggravated, and wherever these molecules are depositing themselves, they're going to be damaging tissue, and there's going to be different metabolites they're excreting as well. So what initially causes this inflammation is a couple of things. Many times it's the food we're eating that we think possibly is healthy and harmless. Some of the most common food allergies actually are eggs, dairy, gluten, chicken seems to be quite common as well, of course peanuts and things like that. But there's many other. You can be allergic to absolutely any food and not be having any outrageous symptoms like a rash or swelling of your throat or shortness of breath, but you can be having this allergic reaction inside of your gut that's damaging your gut and you have no clue. So with these patients who we suspect might have a leaky gut, we do like to do a blood food sensitivity test and find out what foods are reacting so that we can begin an elimination process from the diet and calm down this inflammation. So if it's a very mild food allergy, we'll eliminate it a couple of months. If it's extremely severe, we're going to be talking more like possibly a year, that we really want to avoid that food and allow that inflammatory process to calm down. And along with food, other things can upset that inflammatory balance in the gut, things like bacterial overgrowth and yeast overgrowth as well. And these are usually a consequence of the pH changing in the gut. So though our bodies need to be slightly alkaline, our gut should be nice and acidic. And when our gut becomes a little too alkaline due to low stomach acid, antibiotics, steroid use, or a poor diet, the bad bugs tend to thrive. So the bad bacteria will begin to grow, the yeast will begin to grow, and these things create a lot of havoc and a lot of damage inside of that gut lining and further lead to the leaky gut. So if we want to heal a leaky gut and get all those toxins out of our blood, we need to remove the food that's causing the problem, and we need to clear any infections or any of the bad bugs, as I like to call them. And then we also need to make sure digestion is completely optimized. So the first part of our digestion is our stomach acid. If we are weak in stomach acid, you're going to have symptoms like heartburn or reflux, indigestion, nausea, or sour stomach or stomach ache. And a lot of people are going to take things like Tums or Zantac or the drugs that have now gone over the counter like Prilosec and Nexium. Those are going to either stop production of stomach acid or neutralize it, which for temporary time will relieve your symptoms, but in the long term further hurt your digestion. They will make your gut more alkaline, and you will probably develop a leaky gut at some point from being on those drugs. And they're meant to be very short term. If you read the back of your Prilosec or Nexium, it's going to say not to use longer than 8 weeks. And we know many patients have been on those drugs for years and years because they have no other option. So what we want to try to do is wean those drugs and optimize people's stomach acid. And many times we'll use a product called betaine hydrochloride, which is literally some hydrochloric stomach acid. And some of the older home remedies are taking apple cider vinegar when you eat. Similar type of treatment there to get a little more acid in your gut. And after your food passes through your stomach, it's going to reach the small intestine where it's going to be exposed to pancreatic digestive enzymes. And you have very specific enzymes there that are going to break down fats, proteins, and carbs. And if you don't have enough enzymes, you will not break down your food fully. Your alkalinity will change in the digestive tract, and you will have these proteins that your body does not recognize as natural. They will be seen like foreign invaders, and that's going to begin that immune assault and attack on your food when it's not fully digested. So it's very also simple to take pancreatic digestive enzymes when you eat so you can optimize the breaking down of those food particles. And then lastly, as the food passes into that colon, that's where it's going to be exposed to all that bacteria. And we have trillions of bacteria in our gut. If you added up the weight of all the bacteria in your gut, it's about 10 pounds. So it's a huge amount that we have to balance. And there is a whole life behind the bacteria in our gut, and it has its own ecological system, and it ties into our brain functioning and the rest of our body, and we are learning more and more and more about the microbiome. There was a huge microbiome project that just completed last year, and we're still learning all kinds of things and how every individual bacteria affects our body. So when we don't have enough of that good bacteria, our gut and our overall immune health and our neurotransmitter health really suffers. So that is why people take probiotics, because from the good bacteria, you're going to get a lot of digestive benefits and immune benefits as well. And that's going to help the lower digestive symptoms of gas and bloating and people who are a little more prone to constipation and diarrhea. So probiotics are a huge step. And all those things working together, the dietary changes, the supplements that you might need to take while you're eating, and the getting rid of the bad bugs will all allow this leaky or permeable gut to start healing, and then your overall health will be tremendously benefited.
Wow. Well, let me ask you a couple of questions here. This is fascinating, and I could listen to you for hours, because the information you're sharing is vital. What I experienced personally, and what I think a lot of our listeners experience, is that's very interesting. How does that possibly apply to me? I have brain fog, or I'm depressed, or I'm despondent, or my genes have gotten tighter and tighter over the years, I can see that I've got digestive issues, and I know I'm combining my food, and I know to combine, eat fruit first and then protein and blah 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 blah. Let's talk about the symptoms of leaky gut and Candida, because to me that's what it's all about. Will you just take it away?
Yeah, absolutely. Let me first explain what Candida is to people who've not heard of that. Candida is a form of yeast that can overgrow in the body, and yeast is a very beneficial organism. We have it in various parts of our body, but we definitely have quite a bit in our colon. The problem is when yeast begins to overgrow, and that happens when there's not enough good bacteria. For instance, if you take an antibiotic and you kill off the bad bacteria, you feel better, maybe in a couple of days. But if you kill off too much good bacteria, yeast will overgrow, and many women have experienced that by getting a yeast infection a couple of days after their antibiotic. And so one of the ways to prevent that is to take the probiotics about an hour after you take your antibiotics to rebalance that good and bad flora. But if that doesn't happen, or you've taken a lot of antibiotics, or again you just have this imbalance in your alkalinity in the GI tract, then these yeast will begin to overgrow. And unfortunately, the growth factor for yeast is something most of us love, which is sugar and carbohydrates. And the American diet is extremely heavy in both of these. We used to consume about a pound of sugar a year. Now we're consuming a pound of sugar a week. And, it's no exception in kids. So pretty much all the processed, quick, and fast food is sugar heavy and carb heavy. And that is the growth factor for yeast. And so as it begins to grow in the GI tract, it's going to basically mutate from this safe single-cell yeast organism into this fungal Candida, so to speak, parasite, and it creates a hyphae or a stalk, and at the end of that stalk there's a little hook, and that hook burrows into your intestinal lining and holds on for dear life and stays inside of you and does not pass out of you in very high quantities in your stool, and that hook can also puncture right through that lining again and be a massive contributor to leaky gut. And a lot of my patients have done food allergy testing in the past. They thought they'd healed their leaky gut, and they're still having symptoms, and they don't know what's wrong. So many times we're going to go after this Candida parasite and figure out if that's still there, which is creating this chronic leaky gut that these patients haven't been able to heal. And so with that, again, Candida spores can leak out of the gut, and they can get into the blood, and they're going to look for another host. And areas that Candida love to go to, women would be the vaginal tract, men would be the prostate. Many male prostate issues are due to a fungal infection, not a bacterial infection, and not just a benign enlarged prostate. We've seen many prostates shrink by treating Candida, which is wonderful. It also is going to love the brain. So if you have a lot of Candida in your brain, there are toxins that are going to be released from this yeast organism, one of which being acetaldehyde. And acetaldehyde is another toxin you're going to get if you drink too much alcohol. So many of my patients will describe this yeast overgrowth and their symptoms as feeling hungover all the time. And that's from the acetaldehyde in the brain. So they have this generalized brain fog. And there can be some disconnect in their thought process, or they're talking and all of a sudden they lost their train of thought, or their short-term memory isn't clear and they just don't feel sharp mentally like they used to. And some people, it's so severe, the amount of acetaldehyde in their brain, it actually starts to affect their overall cognition and even their balance. I've had patients who could no longer walk straight, and they've had every neurological workup, and they couldn't figure out what was wrong with them, and it was just the yeast toxins in their brain. And along with the brain, you can get a ton of yeast in your sinuses. So many patients who have chronic allergies and think they're allergic to every flower and tree have no idea that it's just too much yeast in their sinus tracts. It's causing chronic sneezing and congestion and postnasal drip. And it can, of course, get into the ears. The most common symptom I hear is ringing of the ears until the yeast is clear. It can get into your heart and cause palpitations. It can get into the lungs and cause shortness of breath. And inflammation. It can get into the liver, and then we see a lot in the joints and the muscle tissue. And these might be your patients who complain of fibromyalgia symptoms. They're having the fatigue, the tender joints, the tender muscles, and many times that can be too much toxicity, leaky gut, and yeast as well. And then one other symptom we see a lot is swelling. So a lot of patients will have this on and off swelling in their lower extremities or their hands, and that many times is also the yeast and toxin overload. And then the most severe symptom or end consequence can be increased risk for cancer. And the reason we see that is because yeast will change the pH of your blood. And as they release toxins in your blood, you become more acidic. And though the gut should be very acidic, our blood should be just slightly alkaline. Not too alkaline, that's not good either, but just a little bit past a neutral pH. And when there's too many toxins and too much acetaldehyde in yeast, that blood pH will turn slightly acidic. And yeast will also feed on sugar, and like I said, and disrupt your sugar balance. They can even cause high blood sugar or low blood sugar, or high triglycerides and cholesterol, and mess with the sugar in the blood. And sugar is also a growth factor for cancer. So we have acidic blood, we have too much sugar in the blood, and we also are getting an environment in our blood that's more anaerobic. So aerobic means oxygenated. Anaerobic means lack of oxygen. So when your body is deprived of oxygen, the pH is changing to a more acidic environment. We start to develop a body environment that is hospitable to cancer cells. So many people do know we all have cancer. Every one of us has overgrowth of cells in our body. We all have cancer. The reason it's not harming us is our immune system's keeping it in check, and it's just small overgrowth of cells. But when we create an environment in our body that is hospitable to cancer, we're just a great host. So if we're not clearing these infections and changing our pH and taking lots of antioxidants, then we're going to be even more susceptible to developing a cancer down the road.
Fascinating.
Yeah.
Fascinating. As you were talking, I had so many questions come to mind. I'm thinking of so many baby boomers and pre-boomers who have been diagnosed with Alzheimer's and dementia, or just plain old brain fog. And it occurred to me, I'm not a medical practitioner, but there's got to be a tie-in between the Candida and brain fog, as we know, and what they're diagnosing now as Alzheimer's, dementia, and again, I'm asking really rather than saying. Would you comment on that?
Yeah, there's definitely some connection. Alzheimer's is truly a consequence of a lack of antioxidants and oxygen to the brain, so you get these tangles, we call them. And there's also a dysfunction in the acetylcholine neurotransmitter. So when I have a patient coming who truly has full-blown diagnose Alzheimer's, the main thing we really, really want to do is restore the choline in the brain. An amazing product that you can order online is called Alpha GPC, and it's a great form of choline, highly absorbed, crosses that blood-brain barrier, and helps to restore some of that acetylcholine, which gets degraded with Alzheimer's. The other things we want to do, again, is we want to change the pH. We want to get rid of any infection that might be in the brain, which could be bacterial or fungal. And we want to flood the brain with antioxidants, because antioxidants promote healing. So as many dementias are a consequence of inflammation and disruption in the brain, if we can change that inflammatory response and get rid of free radical damage by taking lots of good antioxidants, many times we can calm down that brain. So we want to treat with things like glutathione and N-acetylcysteine, alpha-lipoic acid, resveratrol, so many wonderful antioxidants that can support our brain. And we also want to treat any adrenal issues too. If there's way too much cortisol in the brain, cortisol being our stress hormone, that can also cause a lot of damage to the brain, especially to the hippocampus, which is our memory house. So way too much anxiety and stressors in the life, many people know will hurt your immune system and get you sick, but it also will truly damage your brain and long-term hurt your memory.
Oh, how fascinating. Mm-hmm. This is so fascinating. Everybody over the age of 50, their ears just perked up. And you know what I've noticed as I walk the streets of Atlanta, because I'm so aware, since coming to see you over a year ago, June, July, 14 months ago, I've lost 20 pounds, naturally.
Yeah.
My health has improved enormously, and I'm very excited about where we go from here. But what has happened is now I'm so aware of what people's bodies look like, because what I've seen is when you start putting on the weight, when you start feeling foggy in your brain, you sort of let it go. You have coffee or you do whatever. But now that I don't do that anymore, I see people with guts. Mm-hmm. I mean, big old guts. And although, as I said, I'm not a medical practitioner, to me, I think yeast.
Food allergies, inflammation.
How much beer are you drinking?
Right. And that being said, I do have patients who come in who are way overweight, but will bring me their exercise for the whole week. They'll bring me their diet for the whole week or even whole month. And on paper, it looks like they're doing everything right. And these patients are very discouraged because they've done Weight Watchers and they've done Atkins and they've tried all these diets and they've restricted and their weight just isn't budging, or they might even be gaining. And so those patients, I really have a heart for, because there's so much more going on. It's a misdiagnosed thyroid many times. A lot of times people are told their thyroid is completely normal and the right tests aren't done and they're still low in thyroid. It can be the cortisol issue. Too much stress, too much cortisol, that leads to weight gain. And then, of course, it can be the yeast, the food allergies, and the leaky gut, which keep you so inflamed it makes weight loss almost impossible. So those are the things we really look at and want to optimize in a patient, especially when their diet's already pretty good and they can't figure out why they can't lose weight.
Yes, mm-hmm. and I'm so glad we're talking about thyroid, because I think that's critical. I had no idea my thyroid was peering over the edge when I came to see you. And I feel like balancing my thyroid has been a huge step forward. I can't remember when I felt this good. And wonderful. I've been on this planet over 7 decades, so we're talking major rejuvenation. Now, of course, getting rid of the Candida. We talked about it briefly. Is there something else you'd like to add about what's involved with actually getting rid of Candida?
Absolutely. Yeah, so step 1 is to definitely change the pH of the gut. So if we remember, Candida will thrive in the gut if it's too alkaline. So again, we want to make that pH a little more acidic. So I want to make sure we can wean somebody off their Prilosec or their Zantac if they're taking that every day, and slowly, very slowly, because it can throw you through a loop if you do it quickly, but transition them to some stomach acid when they eat after they've kind of settle down with their heartburn if that's their issue. We're going to add in those digestive enzymes if they're missing, and we're going to flood them with probiotics. So a very common dose I usually end up using with my patients who have Candida is about 100 billion colony-forming units. Sometimes we use less and sometimes we use more, but we use that often. A really great probiotic that you can get over the counter, but it is behind the counter at the pharmacy, no prescription required, is VSL number 3. That is a wonderful probiotic if you're fighting Candida. Some of the other ones that are only in the millions or a couple of billion just aren't going to be quite strong enough to really reestablish the good bacteria. So in some patients, this is enough. They optimize their digestion, they take the probiotics, their Candida clears. For most of my patients, that's not going to be quite enough because their infections are a little more deep-seated. So then we have to do the most difficult part, which is putting them on a Candida diet. So again, Candida eats sugar and carbs. So this is going to be a very strict diet. It's going to have no sugar whatsoever except some lower sugar fruit. It's not really going to have any carbohydrates. It's not going to have glutinous material or dairy because Candida also like this. It's not really going to have any caffeine. It's going to eliminate every single food that would be a growth factor. So it's a very limited diet, high in veggies and meats and things like that. And we use this anywhere from about 1 to 3 months, depending on how bad the infection is. If at the end of a 3-month period, we still haven't cleared the Candida or redeemed this as a really bad infection, we're going to need a little bit more help. So we can use herbals. Only bad thing about herbals is they're only going to work on GI Candida. So if we have the systemic infection, again, from the leaky gut, we got to usually be a little more aggressive. But some great herbals that you can get, no prescription required, are going to be things like podarco, caprylic acid, which is an element found in coconut oil. Coconut oil is absolutely fabulous for GI issues and even skin issues too. You can use coconut oil as a great home remedy for almost anything. Uva ursi is a good one, garlic, oil of oregano. There's many different herbal things you can rotate. And again, these will help to kill the Candida that's in the GI tract mostly. Another good supplement is something called serrapeptase. That is an enzyme that the silkworm actually uses to come out of its cocoon and develop into a butterfly. And that serrapeptase enzyme can be taken about an hour before the other herbal remedies to help puncture this biofilm that covers the Candida. And one of the reasons it's much harder to clear Candida than it is bacteria is that because it has this protective biofilm surrounding it that's very hard to penetrate. It's this protective coating on it. So serrapeptase is great in conjunction with the herbal remedies. And again, that will treat most mild and moderate Candida infections. But again, on a daily basis, I'm seeing severe infections. And these are deep-seated infections that maybe someone's known they've had for 20 years or they may have had no clue. And again, we have the Candida into other organs and it's pretty severe. In those cases, we do sometimes have to use some actual medication therapy. One of which we'll use is a drug called nystatin. Not to be confused with our statin cholesterol medications, totally different. This is an antifungal, and it's going to treat Candida in the GI tract only. So it'll treat thrush, which is Candida of the mouth and that white coating on the tongue. It'll treat the esophagus, the stomach, and the intestines. Now, nystatin is a pretty safe drug. It doesn't have many side effects, but if you take too much too quick, you can have what's known as a Herxheimer reaction or a die-off reaction. And what this means is you feel sicker before you feel better. The reason for that is when you kill Candida, it doesn't just become neutralized, the Candida actually explode. And remember, it's the Candida toxins, such as acetaldehyde and many others, that are making you feel sick in the first place. So if the Candida start exploding and releasing their toxins in your gut, those leak out into your blood, you're going to feel sick. So your symptoms can be exacerbated. Many times we describe it as flu-like symptoms. Nausea, headache, muscle pain, joint pain, fatigue, brain fog. So we have to be very, very careful with how much nystatin we take, and even with the herbals, be very careful. So start out with a very low dose, maybe every other day, and then you slowly titrate that up as tolerated until you've eliminated the Candida in the GI tract. Once you feel that's gone, Obviously, GI healing protocol is necessary. There's a lot of different things that will help to heal a leaky gut and heal those pores. Things like glutamine, quercetin, curcumin. There's many different things we use too to help heal the leaky gut. But we do have to also treat the systemic yeast. And sometimes that will require a stronger antifungal like diflucan. Many women have taken diflucan if they've had a yeast infection. It will kill any yeast in the body. It just does not kill yeast in the GI tract. So you have to treat both sides separate. Sporanox is another one. It works really well, especially if people have skin issues. Another thing we didn't even get into was psoriasis, eczema, rosacea. Those also can be a massive consequence of leaky gut, food allergies, and Candida. So Sporanox will work good to get into the skin. Even people with chronic dandruff, that really is a yeast infection of your scalp. So that can work well. You just have to, make sure these kind of drugs are coming from a medical doctor, and you do have to monitor your liver function, but they're usually pretty well tolerated. There are other antifungals we can use as well, but they tend to be a little more harsh on the liver, so we try to avoid those for the most part.
Oh, that's wonderful. Gosh, so much information. Listeners, you're going to have to replay this broadcast a couple of times because every time I go to see Angel, I get an education. And again, thank you so much. Now, let's get off the yeast now, and let's talk about bioidentical hormone replacement. We all know about those over-the-counter hormones that you can take, but more and more over the years, we, both men and women, have become educated as to the fact that you want it to be as close to your body as possible. Talk about that, because I know that's one of the services that you offer that I'm thrilled with.
Yeah. So bioidentical hormones are going to be quite a bit different than synthetic hormones. And bioidentical means it matches your biology identically. So what's going to happen when you take those hormones is they're going to work just like the hormones your body produces. They're going to land on the same receptor sites and they're going to achieve the same function. Whereas a synthetic hormone is going to be a hormone that in the lab has been molecularly changed, maybe just in a few tiny spots, but unfortunately that hormone won't function exactly the same as your own. Because of its change, synthetic hormones many times will attach to receptor sites they're not supposed to attach to. And really that's the reason medications have side effects, is because they're meant to go and hit a certain receptor and do a certain function, but because they're not natural to your body, they're going to land in other places. And where they land, they're going to affect. So many women have known, and many doctors have known for a long time, that estrogen and progesterone and testosterone are very protective of your heart and your brain. So it used to be common practice that when women hit menopause, they would be put on estrogen and hormone replacement to help prevent heart attacks and strokes. And that was done with bioidentical hormones. And then there was kind of a shift as the pharmaceutical companies started creating their synthetic hormones back 50s, 60s. And the reason they wanted to create synthetic was definitely not to hurt anybody, but it can be patented. A bioidentical hormone, a supplement, a vitamin, cannot receive a patent. There has to be something different about it than nature to make it sellable. So once they got their patent and they got their FDA approval, the synthetic drugs hit the market. That was what everyone was kind of switched to. They had FDA approval. Bioidenticals do not, because they don't need it. And all the women were switched to synthetic drugs. And that was fine for a little while until the Women's Health Initiative came out. And this was a very long-term study on women on a specific hormone replacement drug called Prempro. And that was a combination of Premarin, which is synthetic estrogen, and Provera, synthetic progesterone. And they found these women had dramatically higher incidences of heart attack, stroke, blood clot, breast cancer, and it really changed what we were doing. No longer were women encouraged to get on hormones. They are encouraged to get off their hormones, use them very judiciously, the briefest amount of possible time, 5 years or under, and we really have to be a lot more kind of paranoid about who we're giving them to because of their risk. So that just kind of led to, the decline of hormones. But it's definitely resurged in the last, decade or so using the bioidenticals again. And it's going to be a little more effort on the patient's part because most GYNs and primary care doctors are not using bioidenticals because you really need training in it. These are going to be custom created for you at a compounding pharmacy. So that is not going to be a retail pharmacy like a Walgreens or Rite Aid. It's going to be more of a privately owned compounding pharmacy. And you need a doctor who's going to monitor your blood levels of your hormones. Just because you're having hot flashes does not mean you're low in estrogen. I see women in perimenopause all the time who have been put on estrogen and they don't need it at all. Their estrogen's actually through the roof. The reason they're having hot flashes is they're not balanced in progesterone or testosterone, or they have way too much cortisol. So unless you're doing your blood, you really don't know what hormones you need or how much. So you need your blood work done, and then you need those bioidentical hormones to be custom compounded to fit your individual needs. There's no one size fits all.
Oh, and having been a patient who has taken bioidentical hormones, right from the get-go, I could feel a difference. And then, of course, we moved on to thyroid, which made a huge difference. And, of course, we were dealing with Candida, which I think I'm every woman. I think I represent women of a certain age out there, which, of course, is why you're here today. Now, I know that at Preventive Medicine in Sandy Springs, you do chelation and IV therapies. Please, that's going to be my next step. So please, let's talk about that.
Yeah, so most people have never heard of chelation therapy, but what it is, this is an IV therapy, and it can also be taken orally and in suppositories, but we usually focus with the IVs, and it is removal of heavy metals. And heavy metals are things like mercury, lead, arsenic, aluminum, cadmium, and there's plenty of others. And most people say, well, how would I have had that? I never had any arsenic exposure or anything like that. Unfortunately, most of these metals are acquired through food, water, and air. We absolutely have lead, arsenic, and sometimes mercury in our drinking water. It's in the soil, therefore it's in the water, and it's in the food. If you've ever had a silver filling in your mouth, that is an amalgam filling. There is some mercury in there, and every time you bite down, you're releasing mercury into your system. If you are in a crowded elevator where people are chewing gum, they're releasing mercury into the air, and that's getting into your system. So unless you're in a bubble, you cannot avoid heavy metals. The difference between people who suffer consequences from heavy metals and people who don't is your ability to detox. So there's two levels of detox, and this is something we really focus on a lot too, and it gets a little bit more into genetics, but it's really important to understand. In your liver, you have a phase 1 and a phase 2 liver detox. So with phase 1, that is basically the ability to bring toxins through your liver. So if your liver is a giant roadmap and you have poor detox pathways, a lot of those roads are blocked. Other people who have great detox pathways and all their roads are open. So we always want to, before we do any type of detox with somebody, we always want to open up those roads. And it's actually the B vitamins many times that will allow detox to happen. B12, B6, B15, folate, and getting back to genetics, there's a very, very, very common genetic defect where you can't assimilate or process B vitamins. So when you take them, they just kind of build up in your system and can do more harm than good. So these patients, myself included, I have this defect as well, have to take methylated forms of B vitamins. And these are B vitamins that have already been broken down. They're in their usable state. They're going to be a little harder to find and a little more expensive, but they're going to do so many critical actions in your body. And just one of their actions is stage 1 liver detox. And they're going to open up those pathways in your liver to allow toxins to come through. And then stage 2 liver detox is actually removing the toxins out of the liver and back into the stool and the urine for excretion from the body. So the things that bind toxins in the liver are all those great antioxidants again. So glutathione, N-acetylcysteine, alpha-lipoic acid, resveratrol. Those need to be taken in conjunction with things that help you in stage 1 detox. So this is something I have to optimize in patients before we can then go dealing with their metals. And so the patient who's the poor detoxer will not get heavy metals out of their body. They will get exposed to the mercury or the arsenic. It will be sent to the liver. It can't get through, so your immune system will then carry the metal deep into body tissues to be stored away. If this metal built up in your blood, then you would have arsenic poisoning or mercury poisoning, and you would be close to dying. And your immune system knows that, and it sees this as priority number 1. This is more important than dealing with that cold you just got exposed to. Your body is going to take those metals and store them in your organs, your bones, your lymph system, your tissue, and your immune system is going to keep them there to keep you protected from them. So that does 2 terrible things. 1, wherever they're being stored, the organ is being injured by the metal, and the immune system is tied up dealing with the metal. So again, when we talk about autoimmune conditions and cancers, we want a healthy immune system. If you have heavy metal toxicity in your body, your immune system is unhealthy, and your cells become unhealthy, and the life of the cells is damaged, and the life expectancy of the patient is reduced. So what we do is we do heavy metal testing. We send this chelating agent, and chelating is using a complex amino acid that has a high affinity for metals, almost like a magnet. So as we run this agent through an IV, it starts to suck up all the metal in the tissue. And then the metals will then go back through the liver and be excreted. So you don't want to do chelation if you haven't optimized your detox pathways, or it won't get out. Some of it will get out and some of it will just be redistributed. But once you get the metal out, it goes mostly into your urine and your stool for excretion. So we can have patients do a 24-hour urine collection after the IV treatment and see how much metal comes out. And if they have tons of metal with just one treatment, we know we need to continue that therapy, because it's kind of like stripping back the layers of an onion. With each treatment, you're going to reach a little deeper and a little deeper and a little deeper. So depending on how severe the metals are, we can recommend anywhere from 10 to 30 treatments or even higher. But with every treatment the patient does, they're going to improve their health and their immune system, and they're going to feel better.
Oh, what you're offering is a light at the end of the tunnel, because so many people, I know that you've had them come through preventive medicine, have tried everything.
Absolutely.
And that leads me to a question. I was thrilled to know that you and I used a new blood test to detect Candida, which has not been available before, which is fantastic. Thank God for that. But a lot of times, doctors will tell us that our labs are normal when we know there's something wrong. What's the deal on that?
Yeah. So unfortunately, when a doctor just quickly looks at your lab work, because they're in a hurry, and I've been there and I understand that, is they're just looking for flags in the reference range. When something is out of the reference range, it'll flag as high or low. Your eyes are going to be drawn to that, and you're going to let the patient know there's something wrong. The problem with that is reference ranges are not optimal ranges, and they change all the time. Every lab uses a different reference range. Every geographical location uses a different reference range. So where do these reference ranges come from? They come from the patients. So the lab averages the lab results that are coming in, for instance, for thyroid, and if it looks like the level's getting lower and lower, they change their reference range. So we work with about 3 different labs in my office, and in one lab you might have a low thyroid, another lab you might be completely normal, and another one you might even be close to high. So if you just go by a reference range, which unfortunately that's kind of what we're taught to do, you won't really properly diagnose a lot of conditions, especially in the hormone realm. So you need to know what the optimal ranges are. And functional medicine doctors are trained in optimal ranges. So even though your thyroid is showing as normal, we know you're not in the optimal range and we're going to treat you. Whereas typical doctors say it's in the normal range, you're fine. And you're going to be the person who's going from doctor to doctor and going back every year and saying, please check my thyroid, I know something's wrong. And it's not always something wrong, but if you don't do detailed enough tests and you don't know where the optimal ranges are, you're going to be left being told you're normal when you're not. And unfortunately, our population is not getting healthier. It's getting sicker. So more and more sick people are checking their levels. And if they're low, that only drives reference ranges even lower.
Fascinating, fascinating. Wow. Well, you all do so much at Preventive Medicine. What I'm curious about is where you go in the future. Do you have any new services or anything coming down the pike that you would like to share with us? Because that's going to perk my ears up.
Yeah. One new service that we're just getting ready to start, we're using it at one of our other locations now, is ECP machines. And that stands for external counterpulsation. And this is a treatment for vascular and mostly heart disease. So what happens is the patient's laying on a nice flat comfy bed and they have some compression wraps around their calves and their thighs. And then they're hooked up to an EKG up on their chest. And when the heart beats, that's your systole or your systolic blood pressure, when your vessels are compressing. And then when your heart relaxes, you're in diastole and your vessels open. So what the compression devices are going to do, they're going to squeeze you like a little massage on your legs. It's not painful. When your heart is at rest and in diastole. So that means you have systole, your vessels squeeze, and then you have diastole, and the machine is going to squeeze you. And that kind of tricks your body into thinking that there's some type of blood clot going on. Almost like if you put a tourniquet on your body. The minute you put a tourniquet on your body starts releasing some anti-clotting factors. So this is a very kind of safe, natural way to get your body to producing things like plasminogen and plasmin. And those come in and start degrading clots. But what we're looking for them to really degrade is the plaque, which is the hardening of cholesterol in the arteries that causes heart disease and can cause heart attack and stroke. So it will kind of send these natural factors, so nothing you have to take synthetically or orally, just your own body produces them, and they will go and they will start to very gently degrade and scrape away some of the plaque in your arteries. And this is wonderful for patients who have really bad angina, which is chest pain. They can't exercise, they can't do a lot of things because, sometimes just walking to their mailbox causes severe chest pain. So there's not a lot of options for them except drug therapy and surgery. So this is one of the ways to get their own body to start clearing some of the plaque so they can get back to working out and making those changes they need so they can, have a healthy heart and prevent themselves from just getting worse and worse and worse in their disease. So that's kind of a newer therapy that we're going to be offering. We also just started doing more micronutrient testing and immune testing and antioxidant testing in patients. So this is really good for a patient who's been on a lot of medication therapy in the past, which unfortunately most medicines deplete vital minerals and specific vitamins. So we can actually test for that and start replacing things very specific to the patient and not, so much just guessing what they need and looking at their antioxidant function and immune function as well. And then we've also gotten a newer hair laser that we just started with. It's not so much a laser, it is a light, but you sit under the machine just like something you might see at your hair salon for about 20 minutes. And what it does is it helps to block a hormone in the scalp called DHT or dihydrotestosterone, which is responsible for hair loss. Very responsible for male hair loss, but also female hair loss as well. And it blocks that as well as stimulates the hair follicle and the capillaries around the hair follicle to regenerate. And it works as kind of a growth factor in the hair. You have to do a fair bit of treatments, but usually after a couple months you start to see that hair regrowing.
Very, very exciting.
Yes.
Very exciting. Let me ask you, we have a few minutes left. Have you noticed a trend amongst your patients? Anything new from where you see yourself going? You've already listed a couple of marvelous things, but do most people that you deal with, are we talking about autoimmune? Are we talking about Candida? Are we talking about hormones? Are we talking about the whole shooting match?
Yeah, every day is completely different. Okay. So most of our patients are coming to us via referral from someone else. And it can be anything from they come in and they just say, I'm pretty healthy, but I'm tired. or it can be a very specific autoimmune disease or history of cancer, and they don't ever want to get it again. They're coming in because their heart's, diseased, and they're looking for natural options. It literally can just be about anything. And like I said, we take insurance, so we consider ourselves just primary care. So we will treat pretty much anything and everything to the best of our ability.
Well, Angel, thank you so much for being my guest today. And for those of you who would like to get in touch with Angel, her email is Angel Nofziger, and I'll spell that for you. ANGEL, like Frank, Z like zebra, IGER, at hotmail.com. Angel Nofziger at hotmail.com. Or you can contact me. MaxineTaylor.com. My email is starmax@bellsouth.net. I will put you in touch with Angel. Thank you again, dear heart, for being my guest today.
Pleasure.
And thank you all for listening. And this is Maxine Taylor reminding you that when you change the